name is G.T. Brown, J-I-T-U, last name Brown, proud member of the Kenwood Oakland Community Organization, the Black Leaders Building Together Coalition, and the Chicago Health Equity Coalition. We're here today because Black Lives Matter is a very common refrain that we see on basketball courts, on websites, and talking points. But in one of America's proudest African-American communities, Bronzeville, the center of Black metropolis in the 20th century, in the middle of a global pandemic where Black and brown people are dying at higher rates, Mercy Hospital is still slated to close. We are asking Governor Pritzker, be our champion. You have an opportunity to be a champion on a real racial justice issue. We have been told that Trinity Health System, which owns 92 hospitals around the country, was losing $2 million a month at Mercy until we saw their financials. We know now that in fiscal year 2020, Mercy actually turned a $4.2 million profit, and it is still slated to close. We know this is one of the few hospitals on the South Side where women can safely give birth, and if this hospital closes, it will create a definite healthcare desert on the lower South Side of the city of Chicago, with the next closest hospital being Providence Hospital on 51st, which is also being starved. So we're calling on Governor Pritzker to bring Trinity Health System to the table with the Chicago Health Equity Coalition so that we can not only save Mercy, where there are at least 3 qualified offers, at least, to take over the hospital, but we also want to bring healthcare equity in the city of Chicago. Black Lives Matter means changing how systems operate, not about sound bites, not about slogans. Governor Pritzker, this is your chance. Mayor Lori Lightfoot, this is your chance. So we have speakers today to share with you why this is so critical. And our first speaker, Reverend Robert Jones from Mount Carmel Missionary Baptist Church.
Hello, my name is Reverend Robert Jones, R-O-B-E-R-T-J-O-N-E-S. I'm pastor of Mount Carmel Missionary Baptist Church, a proud member of Black Leaders Building Together, as well as being the secretary of the Hope Center and the faith co-chair of Chicago Jobs for Justice. As I stand here today, at this very moment, in the state of Illinois, there have been 350,875 cases of COVID-19. There have been 9,277 deaths because of COVID-19. I'm talking about the state of Illinois. But not only that, let's talk about my hometown, Chicago. Since 1 p.m. today, there has been 3,714 cases of COVID-19 and 41 new deaths. And we're talking about closing hospitals. This pandemic has exposed some things. First of all, this pandemic has exposed the weakness as it relates to health care for Black and brown communities. But not only that, this pandemic has also exposed the lack of concern that people have to keep the hospitals open that are needed in the community. We call on Governor Pritzker to bring these people together to keep Mercy Hospital open. We know that you have a tremendous pet project going on right now that you want success in. But I stand to say that we can walk and chew gum at the same time. You can walk and chew gum at the same time. We can get what you want and you can get what your community needs at the same time. Governor Pritzker, we call on you to bring the parties together so that we can keep Mercy Hospital open. Thank you.
Thank you, Reverend Jones. Our next speaker will be from the Virginia Burns Hope Center, Miss Etta Davis.
Hello, everyone. My name is Etta Davis. I'm the resident and vice president of the Dearborn Homes Local Advisory Council and a member of the Virginia Burns Hope Center. I am also a patient at Mercy that doctors and the medical staff discovered that I was a diabetic. Yes, walking around with blood sugars of 450 or more. They also helped me to get my blood pressure regulated when I could have passed out at any given time. These are ways that Mercy Hospital has impacted my life. I saw them bring my sister back from the brink of death, not once, but twice. My sister would have died if they had taken extra time to transport her across town to another hospital. This is how Mercy Hospital has impacted my life. We have over 216 seniors, not to mention our disabled residents residing in the Dearborn homes, who are patients of Mercy Hospital. Many of them have told me, and I have been privy to see how Mercy has revitalized a lot of their lives. All of these things have impacted them. When I think about the possibility of this hospital, Mercy, leaving, then I think about all of the scrambling around to get medical records, and perhaps the loss of lives due to wasted time if someone, including myself, should experience cardiac, respiratory, or any other trauma where time is of the utmost importance. There are some in my community who don't even have car fare to get to other clinics, but they can at least walk to Mercy Hospital. So these are ways that losing this hospital would affect me and others. The majority of people who are dying from COVID are black and brown people. So now you want to close this hospital, and especially during the pandemic? We need all of our elected officials, Governor Pritzker, Mayor Lori Lightfoot, Pat Dow, the Black Caucus, and all of our other aldermen, and everyone else to come up with a solution, and we need it now. I listened to Governor Pritzker and Mayor Lightfoot talk about the stats on COVID, and that's good. We also need to hear from you on what you're doing to save Mercy Hospital and other hospitals facing closure in our black communities. I can't hear you. Our prenatal care system is already in trouble, and our babies are dying. We're talking about saving lives, especially during this pandemic. But the Trinity system that runs Mercy seems to think that it's all about profits. Is $4.2 million not enough profit? Governor Pritzker, we need to hear from you, and we need to hear from you right now. Let us know what you're doing to save Mercy Hospital and save lives. Thank you.
Consistently over the last 10 years, we've heard rationale on why shutting basic quality of life institutions down in black communities is a good thing. You heard people say they're going to close schools because we can't leave children trapped in failing school, but never addressing the structural inequities that starved our schools in the first place. We've saw black elected officials sit on their hands while our institutions crumble. Today, we have an elected official that's willing to stand with us. And it is important because Mercy is not struggling, Jackson Park is not struggling, Roseland is not struggling because of bad doctors, bad nurses. They are struggling because of structural inequity. The way that these hospitals are funded guarantees that they will struggle. Just like the way our schools are funded guarantees that a child on Diversity in Ashland has a completely different reality than a child on 44th and King Drive. If you really believe Black Lives Matter, man and woman up and face what the ugly that we know we're looking at. We are tired of scrambling for what most Americans take for granted. We are tired of struggling about what most people don't have to break a sweat to get: a grocery store, a well-funded school, decent housing. It's called sabotage of life. And what we want to do right now is call forth an elected official who is standing with us on this issue. We met him in the streets, and I guess we're going to stay in the streets, Representative. State Representative Lamont Roberts.
Thank you. My name is Lamont Robinson. I represent the 5th District in the Illinois General Assembly. and Brother Brown, we will continue to stay in the streets to save Mercy Hospital. I stand with you as an elected official to say to the governor, J.B. Pritzker, and the mayor, Lori Lightfoot, we need you. We listen to you week after week, continuing to tell us that we will have an uptick in the coronavirus. But we're asking that you show us that you're with us in the closure of Mercy Hospital. We need you to use your leadership in saving Mercy Hospital. We don't need to know why these numbers increase. We know why the numbers increase. Lack of quality health care, i.e. the closure of Mercy Hospital, i.e. the lack of quality housing in the city of Chicago and across the state of Illinois, i.e. the lack of education. But right now, we're talking about Mercy Hospital. And Mayor J.B. Pritzker, Mayor Lori Lightfoot, and Governor J.B. Pritzker, we're asking that you step in. We need you, we need your support to stop the closure of Mercy Hospital. We also need to have a moratorium on hospital closures all across the state.
All right.
We know that we are in a pandemic. So why would we close a safety net hospital in the midst of this pandemic? And so I hope that all of you will join me on this upcoming Friday at 10 a.m. with the Illinois Black Caucus and Black electeds across the state of Illinois, as well as executives from safety nets all across the state. Because when Mercy closes, it will be a domino effect to all of our safety nets across the state. And so please join me on Friday at 10 o'clock a.m. calling for, again, the governor and the mayor to step into place and save Mercy Hospital. Thank you.
Thank you.
Thank you, Representative Robinson. And lastly, representing the largest union of healthcare workers in the state of Illinois, Jackie Algie from SEIU Healthcare, Illinois, Indiana.
All right.
Hello. Okay, we're standing here today for the same reason that we've been standing for weeks now. And that is in support of keeping Mercy and Providence hospitals open. This is a pre-existing condition that we're in. It's called racism. It's called lack of taking care of those that you're supposed to care about. And that's all of us. And especially our Black people. Again, we heard earlier that Black lives matter. We hear it all the time. Black lives matter. Well, we need to see it. We need to see proof of that from our governor and our mayor, and we need to see it now. It is so coincidental, no, it's ironic that when COVID first became a real issue and a threat to our city, to our state, within weeks, millions of dollars were poured into McCormick Place, and it was transformed into a center, a health center that was state of the art. And I understand that only 38 people ended up using it. Well, if we can get that kind of money together, we can put that kind of urgency together for a center that was already existing, never had been a health care facility. If we could do that for them, for that place that was not used as they said it was going to be, we certainly can do it for Mercy. We certainly can do it for Providence. We certainly can do it for St. Bernard. We certainly can do it for Roseland. We certainly can do it for Jackson Park. And the list goes on. And do you notice Loretto, right? Do you notice that where these hospitals just happen to be? They happen to be in the Black and brown communities. And so again, I say these are pre-existing conditions. Racism is a pre-existing condition, and it shows up, and it has shown up during this pandemic, right?
and we want it to stop now. So we're saying to the governor, we're saying to the mayor, we want you to step up and do the right thing right now. Thank you.
Before we open up for questions, thank you, Ms. Jackie, as always. Before we open up for questions, for those that don't know, Mercy Hospital is one of the oldest hospitals in the city of Chicago. One of the few teaching hospitals that exists in the city of Chicago. On May 11th, 1966, a momentous occasion happened at Mercy Hospital. I was born in Mercy Hospital, but also Providence Hospital, which was the first black-owned hospital in the United States. Started by Dr. Daniel L. Williams, a black man, the first man to perform successful surgery on the human heart. One of the few places where we can go and be trained to be doctors and nurses in the 20th century. These institutions matter to us. Like Bronzeville matters to us. Our legacies matter to us. And if we say Black Lives Matter, the proof of your humanity is when people clearly make the case of racism. How do you move? Now we know that several organizations have put in bids to purchase Mercy. We are not endorsing any one plan, but what we are saying is the opportunity to turn Mercy over to a responsible buyer is there. Anyone that will close a hospital after making $4.2 million in profit, after saying they were losing $2 million a month, I don't want them doing healthcare in my community anyway. Anyway. So we're calling for Governor Pritzker, Mayor Lloyd Lightfoot, County President Tony Preckwinkle. Let's stop the sound bites and let's get to work. Thank you very much. Any questions?
Anybody got any questions?
All right, thank you very much. This concludes our press event, and we appreciate your support. Thank you. Good job.